where I'm standing now is behind me is what's called West Point. It's a fishing community in Monrovia. Now, during that epidemic 7 years ago, this whole area was quarantined off by the army in a vain, it must be said, attempt to try and contain the virus into that community. Now there is another outbreak in Guinea, and it is bringing back very bad memories. This was a nation that was traumatized by Ebola. We spent the day in Dolo town, which is just outside Monrovia, talking to the survivors. Now, this is a town that is still referred to as Ebola town, such as the stigma of this virus. Those survivors, I asked them about what they'd been through, but also what they are still going through. And I must warn you that some of the images in this report may cause distress. The road from north to south, travelled less frequently now. The headlines in 2014 called this Liberia's jail. Dolo town, just outside Monrovia. It was cut off by armed guards as Ebola raged through the community. The cemetery says many left this particular prison in a coffin or a body bag. How many people do you know that died?
Every day, 10 person, 15, 20. I think you see the cemetery here. I will show you the way my wife, I buried her with my son. You can see of my wife, my son Alice. She was pregnant, about 8 months pregnant.
And the baby died? The
baby died.
So you lost 4 children?
I lost 4 children. This is her sister too.
Oh.
Grave. She too died. The same day she died, the same day her sister died. The same day, 3 other persons died, but they were carried to Shoffrey and Brand there because they died in the ETU. And a lot of her people died there too. Her mother died to the horse, her father died there. The lay children died. So almost 16 persons perished from the same family. I think you can see this man, other big son. But the other one, I don't know where they carry the body.
You don't know where your children's bodies are?
Only
this one?
Only this and this.
The Ebola virus came across the border from Guinea. These children wouldn't have been born when their community fell ill. But now this is a town forever stigmatized. The Ebola town.
Oh, man.
Dolo town's ground zero, a church in the south. A fellowship of choirs meeting as they had 7 years ago. The cooking and sharing of food as they had 7 years ago. The pastor's wife carried the virus back to the community and the church after nursing her niece in another town. She survived, many others didn't.
My son's wife was 5 months pregnant and she died. My husband died and 2 of our children. Almost everybody in the community was affected, one after another from the church. I am sad and I can't stop crying from guilt.
In 1 week, they lost 42 people from this church. And the pastor's wife now has to look after 16 children, including those of her sister, because she also died. There is no suggestion that time is a great healer. The people I've spoken to here have all told me that not a day goes by when they don't think about what happened. And then, when they hear, as they have recently, of a case in Guinea, it all comes flooding back. By the time the epidemic was over, they'd had more than 10,000 cases in Liberia. Just under 5,000, nearly 50% of them had died. The legacy is a traumatized nation. These images, they can't be forgotten. Yet how to heal? A country already scarred by civil war.
We're talking about depression, we're talking about people being isolated, we're talking about stigma, we're talking about anxiety, and people who already had existing mental health conditions, we are talking about that being compounded. And if you are in the system where access to services, to mental health care is a serious issue, then that just increases the burden of the problem on them.
So at the Carter Centre, they train nurses to provide mental health support. They had no choice. The number of psychiatrists in this country has tripled, but only from 1 to 3. Klubo Mulba trained at the Carter Centre, and she is a nurse, which is how she caught Ebola herself.
I was just serving humanity in the hospital when I contracted it. And nobody in my family came down with Ebola. I alone. That showed that I took it from where I work. What happened?
Survivors live too with the fear the virus will flare up. It hides in the body. And there are long-term health effects.
They told me I have to use glasses to walk. And then my left legs, I showed some nerves got damaged from here. I was in the ETU, I started feeling some pain in these legs here. It got numb, it was very painful and numb. From the ETU, so I said, wow, is this death that is coming from my legs? And then that pain and that numbness, I still live with it.
And now there's a new Ebola outbreak in Guinea, and that has turned the Liberians' nervous eyes towards the border.
We are preparing for Ebola just in case we have a case, or because, one case is an outbreak. So currently, we are having different preparedness meetings. We crafting our preparedness plan and a roadmap to respond to whatever situation that may arise.
When they heard about Guinea, they put down their pans. They stopped their cooking. They hid in the church and closed the doors and prayed. They've calmed down now, the pastor's wife said, but they are watching. They were under the impression in Dolo Town that it was just one case, but in fact it was 18 cases. Now, the 6 nations around Guinea have been told to be prepared. They've stepped up their surveillance, they've stepped up their testing and tracing, and they are also vaccinating both in the centre of the outbreak and on the borders. The World Health Organization says there has been no case now for 21 days, but they will not even begin to breathe a small sigh of relief for another 21 days, and they need the surveillance, they say, to keep going for another 3 months before they can be really sure that they've contained it.